Things from Philadelphia, Pennsylvania. Welcome to the webinar, Increase Patient Compliance by Showing Patients What They Can't See. First, before I tell you a little bit about myself, I wanted to first acknowledge and thank Acteon for sponsoring this webinar. A little bit about myself. I am a practicing dental hygienist with over 30 years of experience. I've experience in both dental assisting, the front desk, and as a registered dental hygienist. The bulk of my experience is in dental hygiene. I graduated the National School of Health Technology in 1982, and I graduated from Coastal Carolina Community College in Jacksonville, North Carolina in 1988. In 2003, which is now 10 years ago, I can't believe it, but I opened up my own consulting business called Perio Therapeutics and Beyond, and it offers hands-on clinical hygiene consulting. I've been featured in Dentistry Today, RDH Magazine, Modern Hygienist Magazine, Access Magazine, Dental Economics, and most recently in the October issue of Dental Products Report. So, without further ado, let's get started on our webinar for tonight. These are the things that we'll cover tonight. We're going to discuss the various types of carie detection techniques and technologies. We're going to discover the benefits of utilizing the intraoral camera and how it increases patient compliance. We're going to learn how selective chromatic amplification assists dental professionals in non-surgical cases and in caries detection. And we're going to discuss and review some before and after photos. So let's start off with Old Faithful, as I call it, the Explorer. Anytime you think of finding a cavity, any dentist or hygienist would automatically think Explorer. But as the photograph here shows, and the close-up especially, what's happening now is this fluoride-rich layer of enamel makes it hard for the Explorer to get what we call a stick. And so many times we get an Explorer, and even the sharpest Explorers, and we can't get that stick, which is what we all know is indicated that there is something, either a sealant that needs to be done or decay. So again, we find ourselves in a little bit different place than we were years ago, back 30 years ago, again just reflecting on my own experience. So we need a little bit more than just a sharp Explorer. We do have transillumination. Probably the product that comes to mind is Microlux. And you can just see the photograph here of the transilluminator, and here really the anterior teeth that benefits the most from transillumination. I find I can do it. I wear a headlight on my loops, and I find that's very powerful as well. And again, that's not all-inclusive to find decay, but it is helpful. Radiographs, probably the gold standard, especially as a hygienist. I always think about getting, bite wings on my patient every year, year and a half, depending on patient needs. And of course, now we have the new guidelines from the ADA that give us a little bit more on how we're supposed to be taking radiographs on the patients. And it's actually much less than the way I was trained, where actually in the beginning of my career, we were taking x-rays sometimes every 6 months, and then evolved to every year, and now it's almost on a risk assessment basis. So if this is the first time, by the way, just to segue a little bit, first time you're hearing about different guidelines for radiation protocols, go to the ADA's website and you'll see it's probably, it might be about a year that there's a protocol out there for us to follow for radiographs. But having said that, of course, we use radiographs to help find decay for our patients. And then we kind of made a big step with the Diagnodent. And this is probably one of the more recent models, the Diagnodent pen. And I honestly can't remember when the Diagnodent came out. Maybe it's been 10 years, maybe longer, I'm not even quite sure, but the product has evolved. But this really helped us because all of a sudden now we had this laser-assisted diode to help us find that decay that was really underneath those occlusal surfaces where the fluoride-rich enamel was just keeping it kind of eluding us with the Explorer. So that was really good. But now we've got this next step in diagnosis, and this is autofluorescence. And what autofluorescence does is it illuminates the dental tissue, and the wavelength is between 440 and 680 nanometers. The exposed tissue absorbs the energy and it reflects it in a fluorescent form back. the images obtained for the fluorescence analysis are superimposed over anatomic images. They're otherwise invisible under white light. You can utilize this unique fluorescence technology to illuminate dental tissues, to reveal caries when you're using it in the caries mode, and we're going to go into all this in a little bit more depth. And also, we can see calculus and plaque in the perio mode, which is a really new concept. And this is something pretty exciting, especially for the hygienists that are on this webinar. It's really going to be a great tool to build on your hygiene department. And lastly, utilizing the absorption properties of the blue light, it differentiates the color of the tissue. So next I want to talk to you about, in combination with this, we've got selective chromatic amplification. Big fancy word for in perio mode, and this product that we're going to talk about tonight is called Sopro Care. And in perio mode, the Sopro Care camera uses this selective chromatic amplification to differentiate the different types of tissue with different colors. And again, we're going to go into this in much more detail. So the next couple slides are going to kind of compound on this theory here. Again, with only finding caries, that's what we're going to start this lecture on about, we can use the intraoral camera because we know it's magnifying things so much larger, and it greatly enhances communication. When a patient sees the photograph like is in front of us, of course we know a picture's worth 1,000 words. You know, you've got magnification of over 100 times, and right with that, we can communicate to our patients what we see and know easily, and they can readily see, and we get great patient compliance because we have a great communication tool. Also, intraoral cameras help on an educational standpoint. Now, as a consultant, I've done this. I'm going to tie in a little bit of periotherapy here for a second, but this is pretty neat. I was actually, this camera, I believe, was, it was the Carestream 1500 intraoral camera. And I use intraoral camera technology when I'm training hygienists during my in-office hygiene consultations. And we see patients a lot of times in the morning. We'll see them for like the left side, let's say, for scaling root planing and using ultrasonics and placing locally applied antibiotics. And then we go in the afternoon and we usually finish up the case. Well, in this case, I was training the hygienist how to use Atrodox. And ironically, although this is a pretty good job, you would say, it's like, well, you know, there's not that much Atrodox that's coming out of the gum tissue here. But in reality, you really should have it tucked underneath the gingival margin. So this side is showing too much Atrodox material. And then I use my intraoral camera educationally to show the hygienist when she actually placed the Atrodox correctly on this other side. You can't even see it where it's placed, but it is underneath the gum line. So it was funny, between the morning, this hygienist, how her technique improved so much in the afternoon. So again, we can use this even in consulting. The intraoral camera is very, very useful. The key is, I think, blending intraoral camera with caries detection. So that's where we're headed with this. Now, we're going to just talk about, this is a webinar, and of course we're on here for, 50 minutes. So I do want to talk about 3 different products here, just before we go into specifically the type of technology I wanted to introduce tonight. But the 3 products we're going to talk about and compare just basically are the Sopro Life device, the Spectra, and then the Diagnodent. And if you all will, because we only have a little bit of time tonight, just take down a pen. I would just want to pass along 2 things of research for you that I came across. And it'll just allow you to kind of expound upon what you're learning tonight. Go to dentalrateequipment.com and you will see comparisons of all the different carie detection technologies that are out there. So how I found this website is I Googled caries detection dental devices, came upon this website called rateedentalequipment.com. And it's too much to go into in just a short amount of time we have tonight, but I will tell you, just to give you an idea, there's a system called the Canary system by Quantum Dental Technologies. You might want to look at that. You want to look at Caries ID. Many of you might know about that. I think that's been out a while, by Midwest, that uses the LED technology to detect decay. Long time ago, I heard about DiFoTI, which is the digital imaging fiber optic transilluminator. That really grabbed my attention years ago, and that much is on this website as well. And then just to kind of highlight another type of technology, the LogicCAN. That's a caries detector by Kodak, and actually it's caries detector combined with your digital radiography system. So again, we don't have time to go into all these different products, but I will say if you wanted further research that you can continue on and look at that website. So what we're going to do is just to talk a little bit about the technology of these three products and the differences. Now the first one, the SoPro Life, it uses blue LEDs which emit light at a wavelength of 450 nanometers. The wavelengths excite the collagen. So that's how this technology works, which in reaction sends the fluorescent light. With the Spectra, it uses the blue LEDs as well, and it emits the light with a wavelength of 405 nanometers. Now this wavelength excites karyogenic bacteria that's present in the dental plaque, and again sending off the fluorescent light. Thirdly, the Diagnodent, which is probably the most commonly used, and I see this in consulting. I'm still in private practice, but in consulting that's usually the product that I've seen out there the most in the past 10 years. And that uses the laser diode that generates a pulse light with a wavelength of 655 nanometers. And again, this works with the wavelength, exciting the decayed dental substances, again in a reaction where it's going to send a fluorescent light. So now I want to talk to you about the next step in diagnosis. This is called SoPro Care, and I do not believe there's any other product on the market that does what this product does. Why you'll enjoy hearing from me, I think, is because I'm a practicing dental hygienist who uses this. So I've got that hands-on, wet-fingered experience, and it really does make a big difference. So I want to tell you about that, a little bit of personal stories, but I do have to kind of go through some logical steps just to kind of get you a little bit up to speed with what this actually does. Now this SoPro Care technology has three different modes. The first one, as you can see up here, it's the caries mode, obviously to detect caries. It's utilizing 3 blue LEDs. When you go into perio mode, which is awesome for the hygienist in the call, I think you're really going to be excited about this, it utilizes all the LEDs. That's the 3 blue ones and the 4 white ones. When you're in daylight mode, all that means is it's just an intraoral camera at 110 times the magnification, and it's only using the 4 white LEDs. There's separate modes on here, so you can switch back and forth between different modalities. The top button, you can be in daylight or a regular intraoral camera, and then go to perio mode, and then your bottom button, just by pressing it down again, you can go into caries mode. So it makes switchover very, very easy and streamlined. You can be very efficient. It doesn't take much time to use this system at all, which is important for the hygienist out there because everyone loves new technology, but what happens is it cuts into the time that we have already scheduled, which hopefully most of you out there as hygienists are getting an hour per patient. I know myself, I'm still in private practice, and there is an office I am in and I get an hour, and there's another office I'm in and I get 45 minutes. So it is a little difficult to incorporate technology if it's not streamlined as this product is. So that is one obstacle they've definitely overcome. Now just talking a little bit more about the 3 different modes. Daylight again is just an intraoral camera. And this has made the intraoral images with a high magnification and high quality. The pictures are beautiful, absolutely beautiful. I'm going to show you some actually in the upcoming slides. The perio mode highlights dental plaque and gingival inflammation. And this is huge, especially me with my focus being non-surgical periodontal therapy. This is really great. This mode uses fluorescence phenomenon and the selective chromatic amplification to evaluate patients' dental hygiene. It highlights plaque, calculus, and gingival inflammation, and I'm going to show you some of this, so it's pretty cool. And the caries mode is a caries detection device, and this provides a detection of decay. The image gives a red warning. It'll come up in red while the rest of the picture's in black and white. Really, really easy to see. I really love it. It's very easy. The focusing ring right away. This is just by your fingertips, and you can go to different positions. They're all very, very sharp. There's macro, one tooth, intra, or extraoral, and I'll just talk to you about those for just a second. The depth of field. This is important here. The portrait or smile. The first, with just a picture of the patient here, this is great for patient recognition. A lot of offices are going to this. It confuses getting back, the senior father versus, the son that's in his 30s and getting, chart confusion and things like that. So this is becoming very popular. And the other photo here where it's the smile, I think this is very important for smile makeovers. Dentists who are doing Botox injections and things like that to get the full look and the way that the lips are positioned around the teeth and so forth, and for periodontists for periodontal plastic surgery. So this is really valuable portion of the intraoral camera. When you go to the next one, which is called intraoral, this is where I am a lot. Intraoral. As a hygienist, I find, I can put that camera, as it shows here, right down on the linguals of the lower anteriors, and I can show the patient with the color differences. You can see it's slight here. This patient actually isn't that bad in our world of dental hygiene. Actually, any hygienist out there is probably thinking, oh, wow, I wish it was that meant. Those are my patients all day long, because that's not very hard. There's pretty much minimal calculus here, as you can see by the orange and yellow. And this, of course, this photo right here is just in the daylight mode. Then moving over, and I will usually switch over when I'm trying to get images for the dentist to help with diagnosis. So again, we've got the bottom, which is the daylight. We go to the perio mode, which is for a hygienist, and it's showing, again, the calculus in the orange and yellow. It's showing that little bit of inflammation around there. Again, this patient is not too bad off. But what I love here is this black and white image and then with the red dot right in the middle. So that helps us to lead the diagnosis in the direction of getting that patient the help they need, and actually advancing in the minimally invasive philosophy, which is really, really very popular these days. And then, of course, we've got macro, and this is very helpful when you're trying to see, as you can see, between the contacts or craze lines or cracks or whatever the case may be. So the depth of field is very, very varying in this product, and it has so many uses. And I can go on. There's probably more, but that's just basically. This I really like, too. Coming back from maybe even 15 years ago was the first time I used an intraoral camera. And the two that I used back 15 years ago, one had a rheostat pedal, which you had to press pretty firmly, so much so that my body would shake a little bit when I was moving my foot, and then my image would blur. And then we all know of the other intraoral cameras that had the button on the wand part, you might say, but you had to press it and engage it. Again, it would blur or shake your image. So what's neat about this technology is you just have to slide your finger across, and it freezes the selected images. So again, making it very, very easy to capture the images that you want. This is a really great feature. And again, I'm not sure that any other product has this, or at least I haven't seen it in private practice or in consulting. I call this a hoodie right here. That's my slang term for that, because it looks like a hoodie, but it's called a SoPro tip. And it's revolutionary because it enables the LED lights to be isolated from all external lights. And that's when the fluorescence in the fluorescence mode, and it's autoclavable. But what's neat about it is, as we all know, I wear a light on my loops. Of course, you turn that light off, you turn off your dental light, but then you still got the overhead lights that are in your operatory, and you've got sunlight that can come in. And one of my offices that I work in have these beautiful French doors, and the light's just pouring in. So this really ensures that this part right here is right up against the tooth, and it kind of just really does protect and put like a little hood over the area that you're capturing. So you get a really nice, clear picture. So let's talk about the caries mode. The dentists are going to be really excited about this. Well, the hygienist might too, but I've never picked up a handpiece in my life, but when I see these photos, I really want to. I'm a dentist wannabe, I guess, but watch and see these photos that are coming up. Let's talk about the technology a little bit. When you discover the caries, the help that we get is you'll see either black or red, and that means there's suspicion of caries. And of course, gray is, the healthy area, and the white, with the tooth. So let's look. I think we're going to look at 5 clinical cases, and they're not really complicated at all. Actually, they're very simple, but it'll just give you an idea what you can do with this technology. So clinical case 1, the first photo in the next 5 slides is just going to be 110 magnification. And then you can see here when you put it on the caries mode, the mouth turns black and white, and you can see right in the middle there a tiny bit of caries. Case 2, where we'd normally say, hey, that's just stain, no problem, the Explorer's not penetrating anything, and that would have been the end of that. Well, here we're finding out, as you can see, the red that's going through the stained area. Clinical case number 3, this is really obvious, even without, the technology, but if you go even further, you can see the varying degrees. In other words, here it's red, but when you get into black, that's almost how I describe this to my patients is, when you see black, that means the doctor could pick up the Explorer like we would traditionally do, and he can actually get a stick there. The other areas are really where it has extended, where we need the technology to actually see to extend the prep a little bit more. Clinical case number 4, again, just looking at the stain here, and again, an Explorer probably wouldn't be penetrating this at all, but then we can see where we get a confirmation that actually we do have a warning of caries. Clinical case 5, again, the same thing. We could see a little bit of the staining, but then we get in and we can really see the extent of things in the groove. So I've seen some amazing things. I'll tell you, yesterday or the day before, I had a patient, and it was unbelievable, but he had been in ortho for, it must have been 4 years, and the mom didn't want x-rays after he got out of his braces. So, there was no talking her into it, so I proceeded, and I thought, you know what, at least I have my camera, and I could put it on the caries mode. And lo and behold, very much like what we have presented here, that's why it reminded me of it, out of each quadrant, 2 molars and 1 premolar in all 4 quadrants either needed a sealant or an occlusal composite. And again, nothing was detectable with the Explorer. The patient didn't want x-rays. I should say the mother of the patient didn't want x-rays for her son. But we were able to, have this technology available, and the mother was absolutely floored. She was appreciative. She still didn't want the x-rays, but we are able to get this patient scheduled and get them the care that they need. So that's where I find it very, very beneficial. And I have another practice where I work, and we have a lot of elderly patients, and finances, make them kind of restrict their x-ray exposure, and sometimes even health-wise, people are going through chemotherapy and things like that. And again, this is my world, what I experienced, and this actually just happened this week too. And when they have something that they don't want an x-ray for, at least I can get my doctor a picture with the intraoral camera and putting it on the caries mode. So this is really exciting for the doctors out there, using this technology during treatment. And what I mean by that is during your preparation. So let's look at, here is just a picture of a tooth in the daylight or the intraoral camera. And anybody can see here, it's like, yep, we see that's probably something going on there. So what we do is we put it on caries mode, and we find, in fact, there's a red area there, and there, and there, and there. So doctor starts to prep, and you can see the prep is starting a little bit here, and they're starting to shape up and prep these areas. And when he's prepping, can see that he can go and be minimally invasive as possible, because he can use the camera to actually view and see when the decay is actually eradicated. And this is the next step, and then of course the remaining of the red was taken out, and then this beautiful composite restoration. Just to show you another one, I know this looks like hot cross buns, but this tooth here, again, it's on the daylight mode, and then we put it in caries mode. So you can see the red in there. Mixed with the black, because this is obvious decay. Probably it was picked up by the Explorer, but when the dentist is actually, picking up the handpiece and starting to drill, you can see here that he can be very, very conservative and just use the camera to keep on doing the prep until all the decay is gone. And then, of course, so I think that's so neat, because that's all the rage now with minimally invasive dentistry, and that is just a perfect example how dentists can use that during treatment. So now, of course, this is right up my alley, the perio mode, which is what I get excited about. And speaking of that, I will say, if any of you, again, we're limited. We're halfway through this webinar already. And I will refer you to a little segment on Fox Business Channel, and it was on television in February of this year. It was a segment called Health Heroes, and if you go to my website, perioandbeyond.com, just on the home page there, you'll see actually the logo for the Fox Business Channel, and you can watch a segment about this company and about the technology, and it just gives you more information than we can cover in the webinar tonight. So now, going to the perio mode. So again, with the color coding, and I alluded to this in the beginning, with discovering deposits, if you see over here where my cursor is, you have orange or yellow, that would tell us that that's calculus, and a grainy and a white patch like we see right here at the cervical, that's plaque. And the gingival inflammation will show up magenta, and pink is actually, healthy gum tissue. So let's go into this. Now, it sure beats, and anyway, I guess I'm dating myself, but when I went to hygiene school, the only way we could instruct the patients on where the plaque deposits were was by using the red coat disclosing tablets or the dye. And nobody likes this. If you're a hygienist, you don't like to use it. If you're a patient, you don't like to have it used on you. So no need for that anymore. So it kind of just throws that right out the window now, because we can actually educate our patients just by using this technology. Let me just show you some examples. Here's, the lingual of number 27. Now, I will tell you from experience, as much as any of us dental professionals look at this film, we can all say, I see the calculus right there. Yep, I see it. No problem. To patients, it's not that easy. So when I have this technology, I can actually highlight, and they will see all the calculus and the gingival inflammation much easier. So again, what is commonplace to us, I can't tell you how many times I have this beautiful large image, and I'm showing the patient, and they're like, well, it's white, just like my tooth. I'm like, well, it's a different color white, And you can tell they're trying to be respectful, but they don't see what we see. And some of them they'll pick up on it, but the more obvious it is, and this one right here, I don't think is very obvious. It's very subtle, but it's much more obvious when you use the technology. Now we'll look at the facial of number 10. So all of us here, everything's jumping out of us, the inflammation, the swelling, you can see the plaque, you see calculus on the facials, you see pitting. Well, we're all dental professionals, so it's very obvious to us. But when a patient sees it like that, we can tell them, look how much inflammation is here when you see the pink and the magenta and the little pieces of calculus that are embedded into the little defects in the enamel there. So it's very powerful for patient communication. Palatal hyperplasia. Now that's a little bit more obvious for a patient, but I will tell you, there's times where, sure, we can see that difference, but to them, they don't really know what's supposed to be what color, and they're so used to bleeding and inflamed tissue that it just does help when we can put it on, like the next one here shows, and I could just say, you see that magenta or that pink? That's how much inflammation is in the tissue, and actually just accentuates even the way that it kind of looks pitted here and flat, and then there's, the swelling and the shininess that you see there. So I do want to bring to your attention, if any of you are thinking about, it is very easy to see the different modalities, just as we're talking about as dental professionals. When you're in the course of the day, what I like about this system too is if you see this little white box down here, I just made a note to remind myself to tell everyone that white box tells me I'm in daylight mode. When I see a yellow box, I'm in perio mode. And not that it isn't obvious, but sometimes, to tell you the truth, in the course of the day, and I'm flicking through and I'm trying to be fast, I just want to make sure, okay, am I in the right mode? Because I may want to talk to the patient about several things and be 3 different modes on, 3 different teeth. So palatal hypoplasia, and it's the same thing here. Again, you can see how it is red and it goes into the pink, but much more obvious when it's that bright magenta color. So again, this is daylight mode and this is perio mode. This is pretty exciting. I'll tell you, this is probably the most valuable lesson I learned in using this technology. And it's a little bit of a story, but I think it's worth sharing. As you know, my focus is non-surgical periodontal therapy. And to explain what I have on the screen here, this is my patient, and she's 85 years old, wears an upper partial, and had a 6-millimeter pocket right there, just straight on. And I can't remember the other pockets, to be honest with you. But the focus here for illustration purposes for the webinar is just to show you, in January of this year, she came in and she didn't want to go to a periodontist. She does wear an upper partial, and oral hygiene is not the best. She's doing the best she can. She's 85. She has some dexterity problems. Took the partial out. I did my full periodontal screening. And again, there were other areas, but in this area there was a 6-millimeter pocket with bleeding and inflammation. So I went through, and this was in her whole mouth. I went through the scaling and root planing, utilizing ultrasonics and using Atrodox and everything that I knew how to do on a non-surgical approach. So when she came back in April, as this slide shows, now again I should reiterate that this is in the perio mode, so you can see all the pink and the magenta. So when she came back and I did my full periodontal screening to evaluate my results, there was a 5 there. Now, I don't get too thrilled with a 5 because I'm so used to, with the modalities that I teach and that I use, I'm used to 6s going to 3s. But again, with this situation, because of the partial torquing and, she had existing bone loss outside of, the pocketing, because you can see the recession here just with the way the crown is, how long that margin is there. So we had some existing bone loss. But what was really significant to me and made me really feel like I did a great service for this patient was that even though I only got 1 millimeter of reduction, look at the difference in the inflammation. That's huge. And I was so excited to share that with her. I was taken aback. And I thought, this technology, it helps to validate my services and helps to communicate to the patient that, okay, we only gained 1 millimeter, but the health of that tissue and the inflammation reduction after 3 months, that was amazing. So I was really very grateful for that experience, and I did want to share that with all of you. So let's go through a couple things here with perio, and just chronologically, almost like we did with the decay. So we have here the first photo, the first situation, again, in daylight mode, meaning there's no enhancement, it's just intraoral camera. Our next situation here, it's showing in perio mode, so you can see where the calculus is very obvious now and the gingival inflammation. Just comparing these two photos, if you're a hygienist, this is huge to have this kind of help for technology. Next, we would go to showing the patient after coming back a week later, where we had given the patient oral hygiene instruction, got them introduced to a power toothbrush, and now we're in the perio mode. And just because the patient is now cleaning more properly, you can see the difference in the inflammation. This is before even the scaling and root planing was done. So next we go to the day of the scaling and root planing. You can see where the calculus is removed, and we still have some inflammation. But, the patient, why the tissue looks so good, by the way, is because piezoelectric ultrasonics were used, and there is much less tissue trauma. So this was the day of SRP in the perio mode. What was really amazing is 1 week after SRP, and again, this is in the daylight mode, so there's no enhancement here yet with the technology, but then that is where the last photo is showing 1 week post-operative in the perio mode. Look at the difference in that. That's just amazing. I mean, it really is. So what it comes down to is the comparison of this initially how the patient presented, and through non-surgical periodontal therapy, what can be accomplished. And that just, I hate to get corny on you guys, but I mean, that's just what makes it so exciting to be a hygienist now. I mean, we're just not chat and polish anymore. We're really helping people, and it's really exciting that we have this type of technology that can help us to actually prove that. So, I'm summarizing here, and I just wanted to kind of point out 10 reasons to use this technology. And I think they really are noteworthy. We want the magnification. This is going to enhance communication. We want to promote professionalism, and people are impressed, very impressed with technology. It also reduces subjectivity in the diagnosis when you have help like this. It motivates the patient to schedule for treatment. There is just nothing more frustrating, as many of us know, and especially I think the hygienist, that you pour your heart out in all the explanation, and the doctor comes in for the exam and he confirms what you're saying, and talk. They go up to the front desk, and what happens? They don't even schedule. And you run behind schedule for what? This really does help the patients and motivates them to schedule. And I will tell you, one of my consulting tips, and I'll share this with you, is to schedule the appointment right there in the operatory. I do it all the time. When they go to the front desk, they're just paying. I've set up everything because I've got a captive audience with all my technology. They're connected to me personally. It's the personal touch, and I do it right there. You know, we have the computers right in the operatories, and then my images are still right up there on the screen, and I think it greatly enhances the patient scheduling for the treatment. They almost become emotionally attached to it from your personal touch as well as the technology enhancing the communication skills. It also promotes early detection and allows for minimally invasive procedures, very important these days. Greatly assists in detecting occlusal caries. I mean, that goes without saying. I think all of us probably thought about that in the beginning of the webinar when we first started to talk about the different ways that we find decay. They're not typically showing up on x-rays unless they get to be pretty bombed out. So that is huge. And again, for those ortho patients that are either in ortho, or in the case like the other day for me where the mom, denied x-rays for the child that had been in ortho. Reason number 6, it provides an avenue to communicate with specialists. Picture's worth 1,000 words. This helps a lot to email, your specialist these photos of what's going on, and helps, again, with just getting smooth communication when you're trying to coordinate, especially with, your big cases. General dentists and periodontists are the biggest benefiters, I think, from this avenue of communication with these photographs and technology. A lot of times, I've seen this, and a little embarrassing for the specialist, but if the general dentist has this technology and the periodontist, let's say, doesn't, they can't put anything on perio mode or caries mode and things like that. So it is important to be able to share with them the information that you have. Also, again, I think I alluded to this, helpful aid for when x-rays are contraindicated or when a patient refuses x-rays. The caries mode improves the dentist's clinical performance. What I'm talking about there is those photos. We go all the way back to the slides where it actually showed the dentist prepping along the way and using the camera to actually see if there was decay still left. Also on perio mode, it improves routine prophies and non-surgical outcomes. And I had, alluded to that with the photographs that I showed you. And also, to make sure you got all the plaque and calculus off when, in difficult areas and difficult patients, this just assists in doing a more thorough job, which is, much better therapeutic outcomes for the patients. And of course, from all that we learned tonight, if you implement it, you have increased office production. So, in conclusion, you might want to know, well, what imaging software will this work with? And I am not an expert when it comes to that end of it, but I will tell you, just about any. You can contact Acteon directly for a complete list. They have technical support there, and they can help you with most of your software issues. It is, and this is the most important, I think, is it Mac or PC compatible? As a consultant, I have to field that question a lot. for my clients who have either one technology or the other, and it's the Mac users. That's their first question. Is it compatible with Mac? That's what they want to know. So you do have the benefit of having it compatible with both. And you may be saying, well, why do I need this type of technology when I can see all this stuff without the aid of this product? Again, a great patient communication tool. It enhances patient compliance, and it shows the patient what they can't see. Most importantly, with periodontal disease, especially with this picture up here, patients, they're just used to having that calculus on their teeth, and it doesn't hurt. Decay will hurt eventually, but with perio, you really do have to rely on good communication skills, knowing your stuff, knowing your research, but also relying on technology like this so that you can help the patient to get the treatment that they need and deserve. This was one of my first questions. Is the light emitted from the camera dangerous? And it is in the visible spectrum of light, so there's no UV rays and no X-rays are emitted. So, and I also, by the way, I will add to my patients, the ones who deny X-rays, I'll say, now I know you didn't want to get X-rays today, so before I get the doctor to come in the room, I know that one area that's bothering you. Let me see if I can put it up on my intraoral camera, which is just like a camcorder, only it goes in your mouth. I do have another setting I can use where it can see if there's any decay, and it will show up in red. There's no extra cost for this, and there's no radiation. Is it okay if I go ahead and get that now? So that's my little shtick, because people are very skeptical these days, and some may question you about this. You know, is it going to cost me anything? Does it have radiation? Things like that. Most patients, 99% of the time, they trust you, they love you, and they're just saying, yeah, that's fine. Do what you have to do. But I've come up with that way of introducing it just because there's going to be that patient that will have those objections, and I think people like the fact that I'm professional and respectful of them and ask their permission.